In Canada, we have one of the best healthcare systems in the world, yet we are still unable to effectively target heart-related diseases. Here are the facts. Cardiovascular disease is the most costly disease in the country, coming in at $21.2 billion in 2019.
And worse than that, it is the second leading cause of death among Canadians, with 66,000 people dying from cardiac arrest every single year. 8 in 10 cardiac arrests occur at home or in public places, and of these, only 1 in 10 survive. Combined with CPR, the use of an AED may increase the likelihood of survival by 75% or more, but for every 1 minute of delay in defibrillation, the survival rate of a cardiac arrest victim decreases by 7 to 10%. That means there are only 10 minutes between life and death, and each minute spent waiting for AED intervention means increased rehabilitation time, increased medical costs, and a decreased quality of life.
Newfoundland and Labrador has the highest rates of heart disease and is ranked the least healthy province in the country. Yet we continue to make unhealthy choices. Back in 2019, when we learned of these facts, it became clear to us that the current system needed to change. An innovative solution was needed, one that empowers communities to work together, improves access to life-saving technology, and reinforces all of this with education for lifelong impact.
HeartStarter can be that solution. This disruptive approach has the potential to change the facts of heart health.
But how are we going to do this? A project of this magnitude cannot and should not be done alone. Strategic partnerships are critical to sustainability.
The HeartStarter business model is intentionally designed to have communities lead the change. It's a grassroots approach that flips the focus from high-level institutional control to on-the-ground community engagement. We partnered with municipalities in Newfoundland and Labrador to work with us on the community rollout. The project has already been endorsed by the Urban Municipalities Committee, meaning that 23 of the largest communities in the province support this project.
The town of Holyrood was chosen for our pilot. This community is known for its commitment to innovation, and a small rural community, they immediately saw the potential to provide a much-needed service to 2,500 residents. We are also planning an expansion to 2 other communities that serve another 27,000 residents. Later this month, we will present at the Municipality of Newfoundland and Labrador's symposium to share our project with community leaders across the province.
HeartStarter has 3 core components: the defibrillator registry, innovative technology, and, of course, education.
Cardiac arrest can happen to anyone of any age without warning. Fortunately, automatic external defibrillators, or AEDs, can administer an electrical shock that restores the heart's normal rhythm and resuscitates the victim. These devices are self-operating. They analyze the patient's condition and are fully equipped with simple audio and visual step-by-step commands. And in Canada, the Good Samaritan Act protects any volunteer who takes action to assist a person in need.
Although AEDs are available in many public places, our province does not have a publicly accessible defibrillator registry. In 2019, we partnered with the PulsePoint Foundation and used their platform to start registering AEDs. The PulsePoint AED app allows users to input the exact location of AEDs, and then anyone with the app can find them in an emergency. Since forming our partnership with PulsePoint in 2019, residents have logged 142 AEDs, improving AED accessibility in 10 communities.
While that impact is significant, a major challenge is getting residents to download the app. No matter how many AEDs are logged, without the app, people will still not know where they are located. We needed a different solution. After more research, we found it. AED Link, a data repository that logs the present and location of registered publicly accessible AEDs. No app required. Once an AED is registered on the site, the system can be accessed by 911 operators and generate and transmit a GIS map showing the locations of AEDs near the caller in need. Registered first responders who are in the area are also notified so that they can assist.
We are in talks with our provincial government to help with promotion and maintenance of the AED Link registry. They see the importance of getting this right, and with the help of municipalities Newfoundland and Labrador, and by using our own social media platforms, we are connecting with communities to educate them on the benefits of AED Link and motivate them to register AEDs.
But what if the equipment someone needs is logged, but it is too far away to be useful? 41.9% of our population live in rural communities. Trying to reach these areas, or any remote location for that matter, by ambulance poses challenging time restraints.
Now, imagine a drone positioned in a central location. It can be halfway to its destination before an ambulance even leaves the station. Attach an AED to it and you're good to go.
Well, it's a little more complicated than that. The drone would need to be fast, reliable, even in our harsh weather, and of course, equipped to carry an AED. We looked on the market for one that could meet those needs, but nothing seemed to fit. So we worked with a local company, RPM Aerial Services, to customize the DJI drone. Given its ability to fly in extreme weather conditions and its proven safety features, this drone works and can also be easily modified to carry an AED.
Costing $14,000, this drone is quite affordable considering its capability. And when modified to carry an AED, any victim of cardiac arrest in the radius of HeartStarter could receive this life-saving device before it's too late. As an example, ambulance response time to Holyrood's Butterpot Park is 18 minutes. That's far past the 10-minute survival mark. A HeartStarter drone can get an AED there in under 6. Think about the difference that can make.
The next step, logistics. Who would fly the drone? From where would they be dispatched?
Well, that's another reason why the community approach works. The drones won't replace current emergency services, but will instead run parallel to them. First responders quickly respond to cardiac arrest emergencies. With HeartStarter, a call to 911 for cardiac arrest would mean the dispatch of an ambulance and, when needed, an AED-equipped drone, giving the caller time to administer the defibrillator before it's too late. With further help from RPM Aerial Services, we are arranging training for Holyrood's 28 firefighters, as well as members of their local search and rescue team to be certified to fly the drone. HeartStarter can then service the town's 2,500 residents.
Beyond AED logs and flying drones, we knew we had to think proactively. That's why our third and final pillar is education. We not only had to educate communities on the presence of HeartStarter in their area, but we also had to ensure that they shift their lifestyles to prioritize their heart health, focusing on what they eat, how they exercise, and the impact of their choices. To advance this goal, we developed 2 new strategic partnerships and created our own educational materials.
We reconnected with Succeed, now a fully functioning independent social enterprise that our team started as a food security project in 2016. We're participating in the development and rollout of a sustainable superheroes education program that focuses on healthy and sustainable food choices. Already, the program has impacted 1,632 students in 68 classrooms. Using this program as a foundation, we developed our own educational material, which focuses on promoting a heart-healthy lifestyle. We also educate on the importance of sustainable choices, as these can positively impact the environment too. By 2050, dietary changes could reduce CO2 emissions by 8 billion tons a year.
Then we teamed up with our local YMCA and started a social media campaign to share this information. And since January, we have had over 11,000 impressions. In February, our province was suddenly brought back to full lockdown in a response to a COVID outbreak, leaving many vulnerable families unable to provide food. We knew that through the YMCA, we could help. Together, we offered heart-healthy food hampers to 40 families. We included our own cookbook of healthy recipes and the ingredients to teach them how to make nutritious food.
Having education as a third pillar will ensure that community members understand how their choices impact their health.
We know that changing the healthcare system could not be done without input from experts. That's why we applied for acceptance into a medtech incubator, Bounce Innovation. We have been in the incubator since January, and now have access to resources and networks to help establish us in the medical technology sector.
Let's pause for a moment. 10 minutes has passed since we started our presentation. That's the maximum amount of time that a person can survive cardiac arrest without help. Clearly, 10 minutes is not a lot of time. This disruptive solution has so much potential, but if we're not able to generate revenue, expanding the project and making it sustainable will be difficult.
We went back to the project's 3 pillars and realized that we needed to offer them as one. The HeartStarter Community Pack includes the modified drone equipped with an AED or any medical device under 2.7 kilograms, the management and maintenance of the AED registry, and engaging educational material.
It costs $22,000 to establish HeartStarter in a community. The plan is to charge larger communities $26,000. We would then generate sufficient revenue to offer smaller communities a reduced cost, so we can add more municipalities and benefit more residents in our province.
12 months ago, Heartstarter was a little more than an idea.
This year, we made a real impact. We took a few wrong turns and made many pivots. When we are taking on a systems change, that is to be expected. Every detail matters.
We developed a business and revenue model that will allow us to be sustainable.
We piloted the concept in Holyrood and are working to expand into 2 other communities.
We established new partnerships with Succeed, the YMCA, Bounce Innovation, and RPM Aerial Services, and have customized our own drone.
We are working with AED Link to provide our province with their first AED registry.
This month, we present our project at the municipality's Newfoundland and Labrador Symposium.
In June, alongside RPM, we present to Hong Kong University in Taiwan as a result of their interest in our use of drone technology.
I think that the Heartstarter program is making our community safer. On 2 ends of it. On the education side, you're giving people the resources that they need to live healthier lifestyles and to set themselves up to be a more healthy, active, and heart-healthy person. But also you're making it more accessible through the drone programming.
Using a drone to deliver an AED, as an obvious advantage that it's a direct flight straight to the person that's in need of help.
I think absolutely this project has the potential to decrease the costs and the pressure on the healthcare system.
If that drone can get there 2 minutes ahead of the first responder, that 2 minutes could save somebody's life.
So I think if we can get to patients more quickly, we can treat them more quickly, we can improve their outcomes, and that's not only good for patients, that's also good for the economics of the healthcare system.
Remember those facts we shared at the beginning?
Heartstarter is on its way to changing those. It's changing the system and empowering communities. It's empowering us to take charge.